Marion. I'm Stacy. Nice to meet you.
Nice to meet you.
What brings you in today?
I got a little bit of a cough, cold.
Okay. How long have you had this?
Like 3 days.
Okay. Do you have any chest tightness or pain?
Yeah, a little bit.
Okay. And you said you have a cough?
Yeah.
Are you coughing up any mucus or blood?
A little mucus.
Okay. Okay. Have you had a fever lately?
I haven't. I don't think so.
Okay. What about any like tiredness or weakness?
Been pretty tired.
Okay. Okay. Have you had any chest or lung problems in the past?
A little bit.
Okay. Okay. Have you been out of the country recently?
No.
No. Right. And how about any allergies? Or do you have any allergies in like the fall or?
Just a little bit in
Okay.
like the springtime, but that's about it.
Okay. What about any chemicals or mold? Have you been around any of that lately?
Not that I know of.
Okay. And so you said you have a cough. Does it get better or worse with anything or like?
Worse when running.
Okay. For sure. All right. So while I was doing her history, I was also observing her breathing patterns and her posture to see if any accessory muscles were being used. I was also assessing the color around the lips and the fingertips. If they were gray or blue, that would be a sign of possible lack of oxygen. All right, so then next I'm going to move on to palpation. So could I have you face that way? And so put my hands out here. All right, and take a breath in. And another one, in and out. And another one. All right, and I'm assessing for any asymmetry with the breathing patterns. And then stay facing that way. Have you say the word 99?
99. 99. 99. 99.
All right, and for that I was feeling for any vibrations. And then, do you have any painful areas? Anything been super sore in your chest, back, neck?
A little bit of a sore throat.
Oh, okay. Face me, please. Let's see. Okay. A little bit of a swollen lymph node there on the right side. And then have you face that way again? So this time I will be assessing for a loud pitch with be doing percussion. You want to do it between the intercostal spaces and using my dominant hand to do the tapping. And any loud, low-pitched noises would be a possible sign of a pneumothorax problem. Mid-axillary. All right, and would you face me, please? And then the same thing, but in the intercostals. Axillary. All right, so that seemed good. No loud, low-pitched noises. So now I'm going to listen to your lungs. And have you take a deep breath in. And again. again. And alright, so your bronchials sounded nice and loud and coarse, which is what we like to hear. Your vesicular sounded nice and high-pitched and breezy, also good. And the bronchiovesicars checked out to be a bit of both, which is exactly what we want. So I think you just have a little bit of a sore throat, maybe some allergies, and you are okay. You'll be okay.
All right.
Stop.